Hi guys, today it's a pleasure for judo training. Today we have Diego Martin. He's my friend. He's from Argentina. So he's a therapist, physiotherapist, and he was working with the Chinese Olympic Committee the last 2 years, especially with the judo team. So hi Diego, how is it going? How are you?
Hello, how are you? Everything
Yeah,
fine?
yeah, so
Yeah.
we are so excited about this interview because I think it's a good information. Maybe you can give us a really interesting information about how is the work with the national team in the judo high
I
performance.
hope.
So yeah, we have
Yeah.
several questions. Also, some of our followers in Instagram they prepare some easy questions for you. I think so. We are going. I would like to that you
Okay.
introduce yourself about the how did you arrive at China, why China, and how was your work in the national team, the judo national team.
Okay. So China. Uh, I start here my adventure. Uh, my before in Argentina, my boss sent me um, a request, for this position in as a physical therapist in China. I didn't know which sports, anything, so I apply, and after a few interviews process, I enter, and then I went to China. There in the beginning, they told me uh, I was selected for the another sport, like ice hockey. And when I arrived to China in the first 7 days, they told me, okay, we are not going to ice hockey, you are going to judo. Uh, Judo, I came from another sport in Argentina, and I know it's something about, but I was not very familiar with the sport, so I start to read, view uh, rules, but was uh, was very easy, like a sport physical therapist, to get in line, right, of the movements, type of injuries, and was good. Yeah.
Okay, and what about the most common injuries in judo? What is in the last year and a half or nearly 2 years? Which injuries did you treat more during the training or during the competitions?
So there is in judo there is a lot of type of injuries, right? It's a combat sport. There is a lot of situations. But in my case, in this 1.5 years, the most common injury was a low back pain. Uh, this team, they had a lot of this low back pain. I think that's because the load, the hours of training, there's a lot of things there. Uh, Joint sprains like ankle, fingers, knee sprain, elbow, shoulder injuries. Maybe not too worse, but injuries. Yeah, maybe 1 week off, or a few days, or 2 weeks, and they need to adapt the training. Um, Also, concussions. Yeah, is one of the maybe most common injuries, but luckily we didn't have too many in this time. Yes.
And about the low pain, the back pain, back low pain, because I read an article maybe a few months ago about the heavyweights category, the heavyweights, they have more problems with the low back pain. Is the same that you find in your team?
Yes, but it's not only the heavyweights. There was in general.
Yeah, in general. Okay.
Yes, because I think the training in this case, right, was very, very specific, always the same moments, training always the big muscles, the general movements, and like unilateral movements, unilateral training, and the small muscles. They don't train it a lot, and there is a lot of imbalances, muscles imbalances, and because the pain, the low back pain. So yes, that the many hours of training, and there is a lot of other situation, right? The pain, most the low back pain is how do you perceive the pain, the psychological factors. There is a lot of factors of the pain, more of why you feel pain, and more the low back pain.
Okay, and the next question I would like to ask you: how is the daily routine for a therapist in a high performance team? So, how is your job? Do you stay in during all the sessions, during all the training session, just in after the training do the recovery, or how is your work there?
So no, we had normally 2 sessions in the day, and sometimes 3, yeah, but normally 2, morning and afternoon. So normally I arrive to the dojo 1 hour before to the training, yeah, to strap in the athletes or do some work before the training, yeah, with some athletes. If a specific athlete need a few exercise, like an extra work, I like to, this is like a microdosage treatment. So I say, okay, come 30 minutes, 40 minutes before, we make some easy work before the training, and yes. Then during the training of the athlete, if any athlete is out of the training, is not training, he worked with me if he needed. And after the training, again, if any of the athletes need some work, like exercise, corrective, something, again, this micro doses of 2-3 exercise, because after 2 hours, 2 hours and a half of training, they are tired, and it's very difficult to them to work for a long time. So 2, 3, 4 exercise, it's a good stimulus. Or that, or helping stretch, or some soft tissue work to relax and feel better. This on the 2 sessions, yeah, morning, afternoon. Also, we had night treatments. We had 2 rooms, yeah, with machines, tables, where the Chinese medical staff does Chinese treatments. I was there too, helping to recover and to some specific athletes, do some or soft tissue work again, or mobilization, evaluation, or education, right? The education for me is important in that time, because they are relaxed, we can speak easy, and the athletes, I think, right, the athlete need to understand the what and the why of the pain. Yeah, maybe they feel pain and there is a not big deal, and they need to understand what happened there. And in the last, this was a special case. In the last 5-6 months, I was more in charge of 2 of the key athletes, One was the captain, and the other and heavyweight. With one, I worked like with this microdoses because she trained a lot. She didn't have much time. And with the other, in addition to the rehab program, because she suffered a lot of low back pain and she had a knee injury for a long time, we worked at the strength session together. Yeah, that was an agreement with the strength coach, the judo coach, her, and with me. And she feels better. Yes, very good, very nice. Was a good work.
Okay, and the next question, I would like to know what is the best and the worst about your experience in China. What do you think is the best for this experience, and what do you think maybe you would like to change, or maybe you didn't feel good with that?
No, I think the experience was, in general, was very good. Yeah, it's I recommend it. It's it's challenging, right? Like professional and personally way, but in a good way, I think. Uh, I think one of the best things was know more about the judo. Yeah, as I told you, I before I know a little bit of judo, but not not too much. And with this experience, I I could know a lot, and it's very nice. It's a good sport. Um, and the the people, the athletes, the was very nice. Was very uh, the fight athletes are very they want to fight in the recovery. Um, they are always open to know to the new ideas to improve and to feel better. The worst, I don't think there is something or anything worse or bad. Yes, the only thing I think is trying to don't lose your mind, uh, fighting constantly with the way of training. Yes, um, they have another culture, way of training, uh, and it's good. Maybe we go with another way of thinking, and you need to adapt. Yeah, you need to adapt and see how you can work and with this new environment or new work. But in general, they are open. If you explain why you want to do this or this or this, they listen to you and they um, they give you like green light to work in general. Yes, so there is nothing bad, or I cannot say the worst things.
Hmm.
You need to, yes,
Okay, and
you
about
need to adapt.
Okay, and after your experience in judo, can you give the coaches some advices about how to prevent some injuries, or which kind of training they must avoid, or which kind of advice can you give to the judo coach, especially in the high performance training?
Okay, so I think the first is manage the training. Yeah, you need to find a good balance between the strength and technical training. Like I told you before, working the little things too. Yeah, the high performance it's so specific that sometimes we can lose the work of other muscles chains, range of motions. So the overtraining always you train the same patterns without giving them these muscle groups a breathe. So if you work the opposite chines muscle, for example, right? It's an example. You can avoid some injuries or pain. The strength training is very important, but you need to be careful of don't get an injury there, yeah, because of bad technique or excessive load. You need to build, for me, right? You need to build a robust athlete for a good performance in the technique in judo. Yeah, this is what I saw. Yeah, it's not always be the better athlete in the weight room with okay, I can lift a lot of weight, a lot of repetitions. Okay, you need to work smart in the strength training to feel better and fresh to the technique in judo, because it's very technical.
Okay, and now we are going to ask some questions because in Instagram, some of our followers they want to ask some questions to you. So the first one is one guy asked about the prevention in the LCA injury. What do you think about it? Do you think it's something that we can do to avoid this serious injury, or what do you think about?
So it's very difficult to speak about this type of prevention, more for the ACL, and more in the fighting, right, with these situations or very quick movements. But I think the work, the proprioceptive work, the unilateral strength work of the leg, the control of the body in different situations, I think it's very important. You can have the bad luck of in a projection of fall in a bad form and broke your ACL, but I think if you work more unilateral with balance, it's a good way to reduce the risk injury. Yeah, we cannot prevent. We can reduce the rate of injury.
Well, but at least is important. Always that you can reduce the risk of a really important injury. I think is a good way to work on it. Yeah. Okay.
Yes.
Mhm. The second question is about the tape in the fingers. Some guy asked about how is the best way to tape your fingers. Maybe yeah, it's different depends on which kind of if you have
yeah, that I think it's very personal of first of the therapist and then of the athletes, right? And what happened in the finger, if it's something preventive or if you have like a injury in or one finger or how many fingers. That's that is very personal, and we need to see that in the moment, right? It's not too general.
Yeah, I suppose. Yeah, and the last one, and the last question.
it's
Yeah.
yes.
Yeah, go. If you want to add
It's not the same like the tape for preventive or to don't hurt your finger or if you are like or two fingers with injury, that is we need to see that in the moment and what happened and the best way to tape it to
Yeah, I
to
think
train better.
to give a general advice for all the injuries depends on the each one. Yeah. Yeah, and the last question is we talked about before, but yeah, he's asking about the which advice can you give us about the most common injuries in the knee, in the shoulder, in the elbow? So, which kind of exercise we can do to prevent these kind of injuries?
Again, it's like uh, so it's that is very general. I think like I told you, the strength training, the main strength training help, yes, but I think you need to focus in the small muscles too. Yes, not only, for example, do like or bench press or pull or snatch or power cleans, for example. They're more like internal rotation, external, and different position. It's not only the typical lateral external rotation. There is a lot of position like stand, uh, in a stand position and lying position, diagonal, concentric, eccentric. Um, that's with the shoulder, the same with the elbow, the same with the knee. Try to work with the motor control and in different speeds of contractions. I mean, concentric, eccentric, isometric, um, of this small group of muscles. Yeah, and that make you a more robust athlete than the big movements.
Okay, so yeah, thank you for your advice, Diego. And yeah, just to finish the interview, I would like to just ask if you want to add any other thing about your experience with judo, or if not, I just we would like to see you in China soon. So
I hope.
yeah, yeah. So
Yeah. So um, this is for athletes or coaches, or if someone is interesting to go and try this experience in China or any part of the world, but in this level of sport. Um, the first thing is you need to work a lot. You need to be patient and always show and explain why you are doing something or why you think this maybe is a better way to work, and that's it. Yes, and for work good uh, and with freedom, I think uh, you need to have you need to win the trust of the coaches. Yeah, that is for me work at that. Yeah. Uh, uh, this is in to speak with the to the coaches. Yes, or physical therapists. I don't know who if some physical therapists are watching this.
mhm. So yeah, I had the opportunity to see you in how was your work in with the national team. So I know that the most of the athletes, I'm sure that miss you after you leave. So yeah, I hope at least they use all the exercise they learn with you and all the advices, and I'm sure they are going
Yeah.
to be
So
much
also
better.
I'm keeping in touch with some of them. Yeah. Sometimes we talk, and I ask them how they feeling, if they are with some injury or if they're recovered, and they told me, and if I can give them some advice or show them some exercise to help them, uh, uh, I'm happy with this with that, because that means they trust
Yeah, yeah,
in
in your
in,
in
in the
your
work,
work.
right?
That's good. Okay,
Yeah.
Diego. So thank you very much for to share your time with us. I hope we can we can keep in touch, and maybe next time we can work together in another judo team. So in
Yeah.
China or in other country, I hope that can do. Okay. So
Yes, I hope the borders get open
yeah. So
fast.
I hope to see you soon and keep in touch. Okay.
Yes.
So
Okay.
thank you.
Okay. See you,
See you.
Felipe.
Bye.
Bye bye.